Hi, I'm Dr. Kelly Pearson, and I'm going to talk to you today about something that is very, very common but scares people, and that is rib pain. And it scares them because sometimes they'll feel it here in the front and they think they're having a heart attack, or sometimes it's in the back and it's so painful that they can't take a breath and they think something is very serious is wrong. These joints can cause a lot of trouble. Let me explain something here. You are one unit. And in this case, on this side you see the colors where muscles attach, and on this side, none. So we'll focus on the side where there's not so much color. You have a rib cage comprised of 12 ribs, and the ribs have a relationship with the sternum, your breastbone, with cartilage. So this is a more clear version. This is actually cartilage and not bone, and then the cartilage meets with the bone along this plane. That's why you have some flexibility in your rib cage, and that's why you can bump into things and push into things and you don't break them. But when you do CPR, oftentimes they will sprain this joint, and this joint is where the cartilage comes to meet the bone and can be very, very painful. But if it saves your life, it's a minimal concern. But what happens in life is this: that these joints, where the cartilage meets with the sternum, that is a joint. It moves a little bit. And as you inhale and as you exhale, those joints all move. And as a chiropractor, when people come in and say, oh my gosh, I've just had this horrible pain back here, the first place we'll look is back there, of course, but the second place is always here. And by that I mean I might stand behind the patient and I might feel their rib and go, wow, 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 is that tender there? And they'll go, oh yeah, that's exactly where it's sore. These joints actually become stuck a little bit, and we can mobilize them very gently. We don't do a traditional hard thrust on those joints, but you can actually have the patient laying on their back supine and doing some gentle breathing techniques to open those joints up. So really important, and here's why. Because this rib meets here, and well, let's do this one where you can see it a little bit easier. This rib meets here and then cruises around, and it meets with the spine actually right here. And what happens then up front is influenced by the back. These two joints move in tandem. And a lot of times people will come in and say, gosh, I'm telling you, this pain back here is absolutely horrible. And you can feel that there is not the mobility when they breathe in and breathe out. That rib is not going through normal excursion. And it's so tender at the joint space. And oftentimes what it just needs is a little adjustment, a little thrust in the right line of direction that it wants to go back into. It's not exactly out of place, but it's stuck in place. So we mobilize this or manipulate this, and it just feels heavenly. And then oftentimes, if it's a serious condition, you'll have to go in and loosen its counterparts up here as well. So that's really important to recognize, that when a rib joint goes out, if you will, or gets stuck, it is really painful, but 9 times out of 10, chiropractor can get that fixed in short order. So I just wanted to let you know about that.